Sounds good. All right. Thank you, everyone. Good afternoon. Appreciate you joining us for this COVID vaccine update with Dr. Cara Christ. As we've done in previous sessions, Dr. Christ will begin with a presentation on the status of COVID vaccine distribution, and then she will take questions. When it's time to ask questions, please raise your hand in Zoom. Thank you, Howie. And we'll get started. Dr. Christ.
All right. Thank you, Steve. Good afternoon, everyone, and thank you for joining us today. For those that don't know me, I'm Dr. Cara Christ, and I'm the director of the Arizona Department of Health Services. I hope everyone had a nice holiday weekend and is having a great start to their new year. One of the things that we want to continue to remind people as we monitor the data, that you are safest at home with those that you live with. If you decide to gather with people who are at your home or elsewhere, you're taking on the risk of potentially having COVID-19 transmitted. This can occur even if someone is asymptomatic, so we always want to take precautions when you are around people that you do not live with. And that includes wearing a mask, staying 6 feet away from others, washing your hands frequently, and staying home when you're sick. So we're seeing far too many cases of COVID-19 because people are letting their guards down at gatherings when they're with people that they trust. So my team and I at ADHS continue to update our plans for Arizona as we get additional vaccine and as we continue to learn more from our federal partners. So today I'm going to provide an update on the distribution of vaccines, some exciting projects that we have been working on since the last time I talked with you, as well as some of the recent data. And then as in all of the previous weeks, I will leave time for plenty of questions. And maybe, can I forward? Oh, there we go. Okay. So I want to take you through some of the most recent data to point out what we're seeing here in Arizona. As everybody is aware, cases in Arizona are currently elevated, and we are now seeing an increase which occurred 3 to 5 days after Christmas. The week of Christmas, we had over 55,000 cases reported. So we are seeing an increase as we move into the new year. So again, this chart I included last week for the first time, but it has been included in our weekly PDFs. This chart shows the cases over time with mitigation measures overlaid. You can see in this chart that the mitigation strategies that are still in place are identified in red on the chart. And those mitigation strategies were the same strategies that were implemented over the summer, but are still in place. And now we added another strategy that we have in our fight against COVID-19, which is our phase 1A vaccination beginning on December 17th in Arizona. I also wanted to share our percent positivity chart with you. Again, if you watched last week, you'll remember this is the percent positivity of the total tests in Arizona that have been performed and reported. This is slightly different than what's on the front page of our dashboard. This chart shows the total number of diagnostic tests that have been conducted in Arizona over time, not just the number of unique people tested. So the gray bars are the number of new cases that week. I'm being signaled. Are we okay? That's perfect. Haha. They're showing me the new remote. So the dark gray bar shows the number of Arizonans that have never been tested before. And the light gray bar is those Arizonans that have been tested before but got repeat tests that week. And as you can see, as the weeks have been progressing, we've had more and more people who are returning for repeat tests. And so a larger proportion of those tests are for repeat individuals. The percent positivity is still increasing in Arizona, but it's lower when you look at the total number of diagnostic tests conducted rather than only those in unique individuals. So we continue to monitor that data as the year goes on. To talk about some COVID-19 vaccine updates and the implementation of our vaccination program here in Arizona. Just to put a reminder, this is our prioritization chart in Arizona. We are doing phased vaccination and are currently in phase 1. We did add last week Arizonans who are 75 years of age and older to be prioritized in our prioritized phase 1B. And that's along with our education and childcare services and our protective services occupations. So that's going to be law enforcement, fire departments, correctional officers. This recommendation was made by the Arizona Vaccine and Antiviral Prioritization Advisory Committee, or we refer to it here as VAPAC. And that's really when there is limited vaccine available, how do we get it to the people who are at highest risk or will have the most benefit by giving them early access to vaccine. That recommendation was in line with the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices, and they had recently voted to include those over the age of 75. So as of today, over 126,000 doses of vaccine have been administered statewide. I want to remind people about Arizona and how public health in Arizona works. We are a home rule state, which means that our local county health departments are the boots on the ground and the experts in their communities. They have jurisdictions for their local areas. They do not report directly to the health department, and we work in a collaborative effort to serve all Arizonans statewide. ADHS provides technical assistance and support from the state level. Counties do have the authority to provide direct services to their communities. But during this pandemic, there have been several times when the state has stepped in to successfully assist with implementing consistent plans from a statewide perspective, but at the local level. And this includes some of the examples such as testing, PPE support, enforcement of mitigation measures, looking at hospital capacity and staffing issues, identifying post-acute care placement, and now we're assisting with vaccine distribution. So over the next few weeks, ADHS will be working to increase access to vaccine, increase the rate of vaccination in Arizona, and streamline communications on how and when to get vaccinated. So for this plan, we have urged counties to begin moving as soon as possible into phase 1B, prioritizing initially those protective services workers, our teachers, our school support staff, child care workers and their support staff, and those that are 75 and older. We expect that most counties, including Maricopa County and Pima County, to be in phase 1B as of next week, which is going to open up vaccination to a much larger group of individuals. We anticipate that this population will be at least triple the size of phase 1A. With the Maricopa County pod, or the vaccination sites reporting strong bookings for the coming weeks, we are working with our local partners to increase vaccination capacity. Governor Ducey's recent executive order helps with this by enabling ADHS to reallocate vaccine to facilitate rapid distribution and administration. And as more vaccine is made available to larger groups, distribution will be expanded to hundreds of vaccination providers that have been registered by ADHS. The governor's executive order actually makes this even more efficient by empowering ADHS to manage allocations to some of those large statewide partners such as pharmacy chains and other groups that may straddle multiple counties, rather than this county being managed on a county-by-county basis. And so we post an infographic every day on our web. We are looking to get this incorporated into our dashboard that updates on a daily basis as well. But you can see which phase each of the counties are in, and that does get updated as we get new information. So again, we work on a local allocator model for vaccine distribution. And as a reminder, the federal partners each week announce the number of doses that are available for the state to order. The state then looks at the statewide priorities, identifies where vaccine needs to go, and then we work with our local health partners based on the priority population that is currently being vaccinated in that jurisdiction. Our local health partners then will tell us which providers in their communities should have orders placed on their behalf from their allocated doses. And so they let us know. We put that back in as an order on behalf of the state of Arizona to our federal partners, and then they ship the vaccine directly to the individuals that will be administering that vaccine. And as vaccine becomes more widely available, we will no longer need to allocate vaccine. Providers will actually just be able to place orders through the ADHS ordering system, just like they do with other routine vaccines. So this week, we received additional first dose allocations of Pfizer and Moderna. We also did receive second dose allocations. We are able to distribute Pfizer doses to Maricopa County and Pima County, and all 15 counties will receive Moderna doses. Looking ahead, we got the allocation for the week of January 11th. So here you can see the number of doses allocated to each county. They're not on the ground in Arizona just yet. They should arrive between Monday and Wednesday of next week. These do consist of both first and second doses. You can find more information about our vaccine administration sites on our Find Vaccine website at azhealth.gov/findvaccine. But initial phase 1A vaccination sites are open for all frontline healthcare providers and emergency services personnel in all counties. And we have 3 counties that have expanded to phase 1B. 180 vaccination sites have been added this week. In addition, the CDC, Walgreens, and CVS partnership began vaccinating in skilled nursing facilities the week of December 27th. But in Arizona, we've had over 2,000 long-term care facilities sign up for that program, which provides on-site clinics for residents and staff. Additional statewide sites will be phased in as we get more and more vaccine. We've got over 650 providers that have been onboarded, and over 800 pharmacies have enrolled with the CDC retail pharmacy program to provide in-store vaccinations. Oh, sorry, wrong thing. We have identified that long-term care facilities in Arizona are a priority. We know that these populations are especially vulnerable to COVID-19. And so we took the CDC up on their partnership with Walgreens and CVS and other pharmacy chains to get our facilities enrolled in their program. And this supports the vaccination of staff and residents in these facilities. And it includes our skilled nursing facilities, our assisted living facilities, along with our group homes in Arizona. They started vaccinating at clinics in our skilled nursing facilities. So these are some of our highest acuity facilities in the state for long-term care. They started on Monday, December 28th. They expect it takes about 3 weeks from the first date that they are able to vaccinate. And so far, over 80 facilities have had at least one vaccination visit to their site. We have activated Part B of this partnership. So initially, we activated it for the skilled nursing facilities. We have activated it now for our assisted living facilities and group homes as well. So CVS and Walgreens will be reaching out to those to start scheduling appointments. As we activate each of the CDC pharmacy programs, whether it's the Phase A or Phase B, or the CDC retail pharmacy, we have to allocate and provide a number of doses off the top to guarantee them that they will have the doses to proceed with the program. So that comes off before the counties are allocated their doses. As we said, 126,000 doses were reported as of January 8th, and I'm sorry, that should be 126,090. I didn't get the edit in there in time. But you can see that we have vaccinated approximately 45% of Arizona's Phase 1A population. Some of these doses are second doses. We've had over 2,000 individuals who have completed their full 2 doses for their complete immunization. As we've started to vaccinate, several counties decided to work with regional sites. Those sites are operational and providing vaccinations for our healthcare workers in our Phase 1A priority groups. Currently, Maricopa County has the 5 regional points of dispensing or pod sites that are activated, and those are throughout the counties, and those have been working since either the week of December 17th or the week after when they opened. Pima County has pods that are also open and is looking to expand the number of sites that they have where people can get vaccinated. Other counties have chosen to provide vaccine directly to their hospitals or healthcare facilities to actively vaccinate their staff, and have also provided it to pharmacies so that they can speed up vaccination. We are working with local allocators on strategies to vaccinate the 75 and older population as we move into Phase 1B. Many of these individuals may have already been included in Phase 1A with the long-term care facility pharmacy, or may be scheduled through their assisted living facility that they currently reside at. But we're planning to identify mobile vaccination strategies for homebound individuals. And we have activated the retail pharmacy partnership with CDC, which would allow doses to be allocated to pharmacies throughout the state, and older individuals would be able to receive their vaccination there. In addition to online registration for some of the vaccine sites, we are also implementing a call center that can assist individuals with scheduling an appointment at some of the vaccination sites statewide, or they'll be able to hand off to other sites that aren't using our registration system. This should open up for Phase 1B scheduling on Monday. Here you can see the doses that are ordered and have been administered by Arizona County. Please note that this does not include approximately 2,900 doses that have been allocated to our tribal partners, or the 37,000 doses that have been allocated to the CDC Long-Term Care Pharmacy Partnership. And again, our numbers are required to be reported within 24 hours of administration, so anything that has occurred within the past 24 hours may not be included in these numbers. And the complete series, this will depend on the type of vaccine that's given. Currently, the only 2 vaccines that are available in Arizona for vaccination are the Pfizer and Moderna. Both of those require 2 doses in order to be fully protected. We do know that there is a potential 1 dose that may be approved in the coming months. And then that complete series would be complete when there is 1 dose administered. So we'll continue to monitor that and provide the information in the footnotes. This is part of the infographic that we post online on our website. And now to talk about a couple of the priority projects that we have been engaged in this week. We have been working to stand up a COVID-19 24/7 state-run vaccination site. I'll talk a little bit about that in the next couple of slides. We've also been looking to expand the CDC Pharmacy Long-Term Care Partnership, in order to increase access to our high-risk individuals that are living in these long-term care settings. And so one of the barriers for moving into phase or part B of that program was the large number of initial doses that we had to allocate prior to starting that program. We were able to work with CDC to get a lower required number of doses for us to be able to begin and get them scheduling. And so we were very pleased to be able to activate that. We also activated the CDC Retail Pharmacy Program. That will not be available until the week of January 18th, but it is really good to bring those retail pharmacies online. So as we get sufficient levels of immunizations, we can start using more and more of our retail pharmacy partners so that individuals can go get vaccinated just like they do with the flu. We're working with our local health departments to increase vaccination sites. This week, Maricopa County and some of our other county partners were able to expand allocating doses to pharmacies and some of our federally qualified health centers. Oh, sorry. And then we also pushed live a webpage that shows individuals what county each phase is in and where they're currently operating vaccination sites, along with the registration link, so that there's a one-stop shop for people to find access to vaccines. That website will continue to be updated and made better, but we wanted to get a place where people could go to find vaccine. And as we continue to get additional vaccine into the state, we will continue to expand to various provider types. And this is going to include hospitals, places of employment, pharmacies, community health centers, and physician offices. The ultimate goal is to get this to all of the places where people normally get their flu vaccine, so that it's readily available when people need it and they can find it. That we know that is several months off until we get sufficient supplies for that to be able to happen, but we will continue to expand as more and more vaccine comes into the state. So updates and announcements. We were very excited to announce that we will be initiating a state-run COVID-19 vaccination site. This site will open Monday, January 11th. We anticipate vaccinating approximately 6,000 people per day. But I have to say, we have gotten such an outpouring of support and the number of partners who have come together to help us launch this site, including the Arizona Department of Emergency and Military Affairs, the Arizona Cardinals, Blue Cross Blue Shield of Arizona, the Catherine and Ben Ivy Foundation, and Arizona State University. And we continue to have partners offer additional services, so this partner list will grow as the vaccination site gets ready to open. We are anticipating starting Monday afternoon with a soft launch and opening registration to the general public starting on Tuesday. We are also looking to stand up additional state-run mass vaccination sites in other parts of the county, and we've scheduled discussions with partners on the logistics of standing up additional sites. So stay tuned on more information on those. This is just the site that we launched. You can see that it shows the phase that each of the counties are in, as well as the doses that have been administered in each county. And then below you can find the county by, you can find vaccination sites by county and link to their registration sites. We are hoping to have this very similar to our finding testing website, so that it will be mapped based and you will be able to find that based around specific locations. And as more and more sites get added to that, that will make that much more easy to navigate. We also announced this morning that Arizona is going to receive $65 million from the Centers for Disease Control and Prevention for vaccine rollout. We were very excited to hear about this funding. This will be used to help us get more Arizonans vaccinated quickly and safely. And we can use it for educational purposes, connecting with communities that may face difficulties reaching a vaccine site, ensuring high quality, safe, and equitable vaccine distribution, as well as other projects that the state deems necessary in order to expand vaccine. So that was very, very good news. We have also been assisting our Arizona hospitals. As we know, they are experiencing quite a patient surge due to COVID-19, and so we have worked to provide different resources throughout the pandemic, but most recently, $85 million has been invested in recruiting nurses, as well as providing funding to our local hospitals who are our major transfer acceptors through the surge line, to help provide, to help offset some of the increased costs that come with the higher cost of recruiting travel nurses, as well as overtime and staffing initiatives within their own hospitals. This The numbers on the staffing initiative change on a daily basis. Sometimes a nurse will accept and say that they're coming and then back out at the last moment. They may get a better offer, but we continue to have almost 350 nurses that have arrived into the state of Arizona. This was one of our biggest weeks for the arrival of nurses, and we are anticipating even more as the month of January goes through. They are assigned to their hospital. They are supposed to originate from outside of Arizona. We did not want to utilize Arizona healthcare providers in this initiative. And then they stay in Arizona on that site for approximately 8 weeks. And then hospitals have the opportunity, if they want, to extend that contract or to offer those nurses to stay long-term. The other thing that we will be launching in the next couple of days is our healthcare worker toolkit. This toolkit is designed to provide healthcare workers with information and facts about COVID-19 vaccine. It urges our healthcare providers to get vaccinated and then to talk to their patients and encourage their patients to get vaccinated. We know from some of the research that we have done that patients are likely to trust their healthcare provider and their healthcare provider's recommendation. So we want to make sure that our healthcare providers are armed with accurate information as well as answers to commonly asked questions by patients. The assets that I've put on the screen are just a sample of the small sample of the very many assets that we will have available to healthcare workers and healthcare facilities, encouraging them to get vaccinated. All right, and with that, I will take any questions.
Thank you, Dr. Christ. A reminder to raise your hand in Zoom, and I will call on you. First up is Cameron from 15. Hang on a sec, Cameron.
Hi, Dr. Chris. One of the big questions that we're getting from a lot of folks, especially 75 and older, obviously we know teachers, police officers, those in the healthcare community are going to have a little bit more guidance on when to register, how to register, because they're going to have people there with their HR people walking them through that process. 75 and older are going to really depend on the state as well as the news media to explain how to register. How do they register? Where are they going to register? Are they going to register with the state? Are they going to register with their county? Where will that site be? What will it look like? We really need a little bit more detail. And not only that, but what are the alternative ways to register for those folks if they don't have a computer, internet, so on?
Yeah, absolutely. That is a great question. So starting on Monday in Maricopa County, and you can use this website for all of them, but we will be opening up registration for the prioritized phase 1B. So that includes our over 75 population. There will be multiple mechanisms on Monday where people can either go on our website to register at a state. We have a registration system for state-run facilities and some county facilities. If you go to azhealth.gov/find-vaccine, it will take you to the page where by county you can find a location that is close to you, and it will link them directly to that pre-registration system. Now, we also know that not everybody has access to either a computer or the internet, so we also will have a call line where people can call and somebody on the other line will register an appointment for you or tell you how to get to a site that is near you. So while we won't be able to register for every single facility offering vaccine, they will be able to direct them to how to do that if it's not a state, if it's not in the state vaccine management system. We will be getting that information out. Oh yeah, go ahead.
I'm sorry, is it true that 211 will be offered?
Yes, so we're going to be working with our partners at 211 and Poison Control, who have been providing a lot of our COVID information and have information on COVID vaccine. They will be able to help assist with the registration. We have a process in place where if someone wants to call 211, they can, and they will make it to the appointment scheduling section.
Can I ask one more question?
Sure.
When it comes to the State Farm Stadium site, It looked like the opening day and possibly the first couple of weeks are probably going to be those left over in 1A, the medical workers. And then it looked like police officers, law enforcement would be using that site. How soon until age 75 and older will be able to use that site?
So age 75 and older will be able to use that site starting next week. And so it will just be on a first come, first serve by appointment basis. It will be available 24/7. We're anticipating running through about once we get going, running through about 250 to 500 people per hour. So we're hoping that that will expand. And as we expand those sites, what we're hoping to be able to do is to basically copy what we've done at the State Farm site at other sites to offer more access. So the 75 and plus will be able to be vaccinated at the same time as the teachers and the law enforcement.
Can I ask one more question?
Sure.
Okay, last one. So expanding locations is going to be a top priority here. Obviously, you guys have 650 provider locations throughout the state. You've got 800 pharmacies signed up. How soon can we expect those? Because I know you said that might take several months to get enough vaccine to get it out to providers like that. How soon can we see the first ones begin, especially in Maricopa County? Because I'm sure that a lot of people want to see those expanded to more convenient locations. How soon can we see that expansion in Maricopa County specifically?
So we're hoping to start that either at the end of January to the beginning of February, at least having, even if it's limited doses in pharmacies, expanding the number of pharmacies and like those community health centers that have access to it. For it to be widely distributed at pharmacies or doctors' offices, we're probably looking at late spring by that point. But hopefully by then we will have it in some of those retail pharmacies as well, more and more each week.
Thank you.
Thanks,
Next
Cameron.
up is a Howard Fisher.
Howard Fisher. Hi, Howie. I don't hear him.
There we go.
Okay.
There we go. Well, good to see you again, Doctor. Let me follow up what Cameron said. Not everybody lives in the great state of Maricopa. What about those other pesky 14 counties? When are they going to start seeing multiple sites and 1B inoculations?
Yes, so I really like my local county partners, and I don't find them pesky. They are all working on strategies, and we're working on that. So that CDC retail pharmacy had to be activated by on a statewide basis. So that will actually be statewide, and some of our local other counties, some of our more rural counties, are already expanding to pharmacy-based because those are very convenient for those areas. We are working with Pima County, who is going to be adding additional mass vaccination sites and extending the hours at some of those. So we are looking at this from a whole state perspective. I would just say we will add all of those sites to our website so that people can see where those locations are as they're brought on board.
Okay, two other quick questions here.
Yeah.
You mentioned that 45%, the 1A you had 40, and now we're going into 1B.
Yes.
Are people in the 1A category just not wanting to get vaccinated? What is going on there? I mean, if we're moving into 1B and we haven't even vaccinated half the people in the 1A, what's happening?
So we know that there are still healthcare providers that have scheduled appointments. They just haven't had them yet. So we anticipate that number will still increase. The 5 vaccination pods in Maricopa County are continuing to operate over the next several weeks to continue finishing the 1A and move into the 1B. And so our site is just complementary to that, but we'll add additional sites so that we can help with the increased population of 1B. When we move into other phases, it does not mean that those 1A people have lost their opportunity to get vaccinated. They still remain eligible for vaccination. And we know that as more and more people get vaccinated and talk about their experience, people who may have not been comfortable getting vaccinated early on may opt to get vaccinated later.
Okay. one more thing to make myself my normal pain in the you-know-what here. We're looking at 7% bed availability, both ICU and inpatient. We're looking at record numbers. We're going to hit 10,000 deaths probably overnight. And yet we keep hearing, oh, everything we're doing now, we don't need to change our mitigation strategies. We still got, we're giving money to the restaurants so they can encourage more people to eat outside. At what point do we need more mitigation strategies? You obviously heard what Marjorie Bessel said the other day, and she said, as far as she's concerned, we need a lot more. The state's not doing a good job. You're the chief health officer of the state. When are we going to get to the point where we should actually implement more mitigation strategies?
So that's a great question, and thanks, Howie. I think, as we're looking, what we need people to do is to actually follow the mitigation strategies that are in place. Again, we're still seeing that small gathering spread. That when you look at the data, 3 to 5 days after Christmas and Christmas Eve are our highest days yet. So, we know that people got together. We know that they let their guard down on Christmas and Christmas Eve, and we saw the resultant spike after that. We're still waiting. The spike from New Year's will likely come this coming weekend, so we anticipate seeing another increase in the data. But we need people to wear their masks. 91% of the state is covered by a mask mandate. There's not local enforcement going on. So I think that that's difficult. And as you look at what other states are employing, California has some of the strictest mitigation strategies, and they've even got less hospital capacity and higher numbers than Arizona. So I think, we're really encouraging everybody to not let their guard down in those places where they feel safe.
Okay, I give up. Thank you.
Thanks, Howie.
Next up, Dennis Welch.
Hi, Dennis.
Good afternoon. Just want to follow up. Can you hear me?
Yeah, I can. Sorry, the voice comes from over here.
So just wanted to follow up with Howie on mitigation. I know he said he gives up, so I'm not quite giving up.
You're not giving up.
Yet. It seems like there are no more mitigation strategies. The strategy now is just to vaccinate people, regardless of what happens. Is that accurate?
So we continue to do enforcement of the mitigation strategies at in those establishments that we have authority over, requiring masks. I know we went out to some gyms that weren't requiring masks and doing that. A lot of our focus is on vaccine. We know that that's one of the best tools that we have, but we are really trying to make sure that people are following those mitigation strategies too.
Well, the question, wasn't about enforcement. The question was about new mitigation strategies. Is it fair to say nothing new is going to be coming down the line? This is what we have, and vaccine is the plan now.
Well, I think that right now the plan is to continue with the mitigation strategies we have, and we continue to monitor what other states are doing and seeing if there are, other things that we have seen that have worked. But as you're looking at what's going on in the other states, there's not a best practices model. You've got Florida, who has no mitigation strategies, that's in the same boat. You've got California, who has stricter mitigation strategies, that is in the same boat. It's a really tough balance when there's not an established best practice.
And then moving on now.
Yeah.
Howie mentioned the 7% bed capacity. ICU beds are filling up. And I'm looking at this story that was reported in the Republic at the beginning of December. It says St. Luke's Medical Center in Phoenix remains a last resort for Arizona COVID patients. Is that hospital not going to be used? Is that a dead idea? Because if this isn't a last resort, what is? And when would you open up St. Luke's?
So that's a great question, and we're getting a lot of questions about that. I think as you look at St. Luke's, when we initially went to build out St. Luke's to be an alternate care site center, we were thinking acute care and potential ICU beds. When we brought our partners together, they said, we don't want you to do acute care and ICU beds. What we really need this for is a post-acute care facility. We want to manage ICU and acute care surge within our four walls. We took that feedback, It was it was built then to be a post-acute care facility. It can handle ventilators and things, but the problem isn't so much the number of beds, it's the staffing. And so in order to quickly staff that up, we would need to pull staffing from other sites in order to be able to staff St. Luke's. So we have been working on the post-acute care site, so it's the same exact services that would be provided at St. Luke's we hold beds, post-acute beds, for us to transfer patients that no longer need to be in an acute care setting into those settings to open up more beds. We are currently, we manage that through the Arizona Surge line. We also established a transportation so that we can provide the transportation quickly to those sites or to get a person back home. So those are in licensed care facilities that are already staffed, that the state is paying for additional hazard pay for them to keep those open so that when we need to move a patient into those, we can do that. So St. Luke's is always an option if those beds fill, but we still have beds available in our post-acute settings.
So it doesn't sound like you're gonna open up the hospital, and it's looking more and more that when you stood with the governor there several months back, that was just nothing but a photo op. Is that?
No, so St. Luke's is a registered warm site. We can stand it up if we need to, but
Why aren't you doing it? Again, I know you're saying there's still people there, but we're looking at these hospitals that are overburdened right now. We're reading stories about ambulances being diverted to different hospitals because this hospital is at 100% and can't handle anything more. Why not open that and use that as an asset?
so it would.
At what point is it opened up? I mean, what metric are you going to look at and say, okay, now's the time to staff this up?
Yeah, so it was, by the time we got done working with the Army Corps of Engineers, it really was intended to be a post-acute setting. If we need additional post-acute setting beds, we would look to open up St. Luke's. But we do currently have capacity in our post-acute beds. So we would not be opening up St. Luke's as a potential hospital.
Okay, thank you.
Thanks, Dennis.
Sanders?
Hi, Dr. Chris.
Hi, Josh.
Hey, a couple questions for you. Let's just use kind of a sports analogy with State Farm and that announcement. It's been really more than 3 weeks since the governor has been out in front answering questions as we've seen this COVID just erupt in cases, and 76,000 alone, 8 days into the new year, and 1,000 additional deaths reported. It's almost like, just following up to what, Howie and Dennis just said, and what healthcare workers, our hospitals are reporting, it's almost like you and frontline workers right now are an offensive line without a quarterback. And my first question, how important is it right now for our governor to be with you and to be in front of this and to answer some of the questions we have and some of the questions that our community has? And how has the governor supported you in the last couple weeks?
Yeah, absolutely.
That's my first question.
Okay. So I would say, the governor does feel that it's important to communicate with Arizonans. This was really intended to be an ADHS vaccine specific briefing, that's really technical and in the weeds. It's probably not the best use of the governor's time to be here with me as I'm talking, number of doses and things. But I will say, we work very closely with his team. I am in daily communications with them. They are providing us with the support, for this state-run vaccination clinic. That has come together in a very, very short time. When I go and I ask for funding to help support our hospital partners, they find it for me, and we are able to get it out to them. So the support is incredible. And this really was an ADHS specific thing. And I'm happy to, work with you guys on a weekly basis on that. For his scheduling, I know that he's got a lot of commitments, and you'd probably have to ask the ninth floor for that.
Well, we have. It's just that's the thing, Dr. Chris. You're in a tough position, and we all of us know that. We're aware of that, and honestly, my heart goes out to you, and I appreciate the work that you're doing. I know that Arizonans do as well. Second question: we have seen some issues with the rollout, right? You know, you mentioned 126 Arizonans have received the vaccination, and yet the state has been allocated over 420,000. We're expected to almost get 590,000 next week. But there have been some challenges. Especially in Maricopa County, 2 of those pods were closed because of staffing issues, right? So, what are some of the challenges you think that we're facing right now, and how do we troubleshoot those?
I think staffing in almost every aspect is difficult. I think, there's trying to find people who can, be either a healthcare provider in a hospital or on the front lines vaccinating healthcare workers. That is a challenge. I will say, though, over the last week, as we've been putting together like this state-run facility, partners have really stepped up. We've had Blue Cross Blue Shield come and say, our team wants to volunteer. We will volunteer for the 8 weeks, and we will staff the shifts. ASU has been amazing with the resources that they've given, and now what we're trying to do is connect some of those vaccination sites who may not have realized that they had, that there were all of these willing partners to them to see if we can get them additional staffing too. I think, as with public health, we are usually very crafty and very we try to preserve resources. And I think in this case, we were trying to go on what we had. We've had a lot of additional resources come in just in the last couple of weeks, so that has been very nice. And you will be able to see access to expanding vaccination opportunities. The other limitation, though, is going to be the amount of vaccine coming into the state. So some places needed a certain amount of vaccine in order to be able to stand up and operate. And so as that was coming in, they were assessing whether or not they would be able to fully operate for a week or to start some of those strike team activities. And so as they've been getting more vaccine, now they are able to go do those activities. And so that you will see the vaccine access and the speed of distribution pick up as well.
Just to follow up to that, and I have one last question. But even the governor himself said the vaccine isn't doing anyone well.
Right.
Anyone could stay in a refrigerator. So it seems like we've gotten a large number, but we've only vaccinated a fourth of those, or 2/3 don't, or 3/4. So I guess I don't see there's a disconnect there for me.
Yeah, and that's something that we definitely are working on, because we're not happy with the speed of distribution either. We want to get it out faster. So as we're seeing how those allocations come in and where it might be sitting, the executive order did give us the authority to go back and take and reallocate doses that may be sitting in places throughout the state, so that we can get them to more of those high throughput vaccination sites, so that we can get it out more rapidly. But yeah, that was something that we're not content with either.
My last question, Dr. Chris, this deals with the $65 million that we're getting from the CDC. This is really important, I think, going forward, because the money, some of the fund is supposed to focus on community engagement and distribution equity.
Mm-hmm.
Dr. Edmund Baker received his second dose of the vaccine 2 days ago. That's something he's passionate about. And I'm wondering what are the strategies right now to engage communities that may be afraid of the vaccine, or those disenfranchised communities that may not have access again to a computer, even to a telephone, right?
Right.
How do we tackle equity issues we have when it comes to the vaccine?
So that is something that we're looking at as we move into our Phase 1B and Phase 1C populations. So we will be working on some campaigns to encourage individuals to get vaccinated, and some of that will be targeted messaging directly to some of those more vulnerable or resistant populations. We're also working with communication strategies in order to target populations where we know that there has either been high rates of COVID or high rates of vaccine hesitancy, to get out there and do like local grassroots campaigns to get those types of individuals, and then working with our FQHCs and some of those trusted providers like Equality Health and CLPC that are trusted by those communities to allocate vaccine to them so that they can provide the vaccine directly in those communities through those smaller settings.
Thank you, Dr. Chris.
Yeah, thank you.
Next up is Mike Pelton.
Hi, Mike.
Hi, Dr. Christ. Hope you're doing well. A couple of follow-up questions to what Dennis was asking about on St. Luke's Medical Center. We had a copy of the contract, the state contract, I think, as of July 20th, but as of this morning, I cannot find that contract anywhere on the state's portal. So my question is there still a contract in place with the state and PAE, the contractor, or I guess anybody, to activate St. Luke's Medical Center? And if not, what happened with that contract?
No, it should still be in place. Let me see why it was pulled down, but it should still be in place. We have not canceled or inactivated that contract.
Is the contract still in effect with PAE?
It should be, yes. I have not heard that we have changed that, but I will go back and double check. But that is part of the St. Luke's Warm site, is having that contract. So we'll double check.
Okay, I was wondering, because we had heard that potentially there were issues with that contract. So if that is still in place, the way I read that contract was that it could either be post-acute care or ICU level care. I know you referred to that. I believe the staffing was also part of that. So, we're hearing from hospitals that don't have any staff, or some hospitals, they're running low or don't have any staff ICU beds. So it's time, at what point do you go back to hospitals and say, hey, should we turn St. Luke's, since it's in the contract, to be served for an ICU, in an ICU capacity? Is that something we're actually going to activate, especially given it takes 2 weeks to open this thing up?
So yeah, so that contract should still be in place, and it does allow for either an ICU or a like the post-acute care. As they went back through, we were identified that there was a reduced number of ventilators that the St. Luke's building could support, so it couldn't fully be an ICU. That was just based on the findings by the Army Corps of Engineers. The difficulty has been the staffing, even as we've been working with these national corporations to try and bring them. They will recruit, they'll tell us how many are coming, and then a reduced number will come, they'll recruit some more. So the staffing really, really is an issue, and trying to staff up a full hospital we know would be difficult, but it is an option. It's still an option as we move forward. But, as you get into that more specialized level of care and you need ICU docs and ICU nurses and the critical care experts, those are even more scarce than those that can provide post-acute care. So those are the things that we take into account as we're determining, what level, like what kinds of things are available options.
And then my last question on that is just if it hasn't been open to this point, if it's not opened up, to this point, how much money has been poured into getting that thing ready, and would you consider it a wasted resource if it's not activated?
It is always there as potential beds, but it's not necessarily the beds that are our barrier. It is the staff, and so we would be faced. I don't think that it's a waste of money, because we can stand it up if we need to, but right now we do have an adequate number of post-acute beds, and so that is what ultimately we landed on St. Luke's being after all of the discussions and all of the things that we did. So we will continue to have those conversations, but I think right now having different available options is never a waste of money. I'd have to go back though and look at all of look at the funding that was put into that. I'm sorry, I don't have that on the top of my head.
Well, I appreciate it. Thank you.
Yeah.
Peter Seymour, KTAR.
Okay. Hi, Peter.
Hello, Dr. Chris. Good afternoon. And I might get my questions up here handily. So as we know, some schools are going virtual only. Shouldn't perhaps maybe the state ask all schools to go virtual only at this point? I know the benchmarks are not requirements. Should they all go virtual? What's the best path right now? Because the spread is soaring statewide.
So all of our counties are in the criteria for schools to consider going to a virtual option. They are all in that substantial range. Again, like you just said, you're correct. They are recommendations. They are not requirements. And we would recommend that they work with their local health departments. Some school districts have put very, very good mechanisms into place to prevent the spread, or have asked people not to return if they did any kind of gatherings or traveling over the winter holiday. And so we do leave it up to their local boards and the local jurisdiction. But we did put the benchmarks so that there were recommendations based on that. And I'm sorry, I forgot the second part of your question, Peter.
That was pretty much
Okay.
it was all together, but I do have another unrelated question. Last month, you told us that, I think it was Pfizer that was not giving us as many vaccines as was expected.
Yeah.
Has that changed? Have they made good on their vaccine promise or original pledge? Or if not, why have they not? What was the reason for the shortage in the first place?
So what we were told was that those were just placeholder numbers, like for us to be able to make plans, but they weren't guaranteed doses. And so when they went back and looked at what finally was coming off of the manufacturing belt, that was what we ended up with. So we did end up with a reduced number of vaccines in the month of December because of that reduction in the Pfizer allocations. It does not look like they're going to go back and make whole on that because it wasn't a guaranteed number is what we were told.
So that was a shortage of about 29,000, and that's where it's going to stand, the shortage of 28.
Yes, and as it continues to open up and as they bring more vaccines online, we do anticipate that we will get more and more vaccines like through the next few months.
Great. Thank you.
Thank you.
Next is Matt Galka.
Okay. Hi, Matt.
Hi, Dr. Christ. I have a few different questions. They kind of span the spectrum here. And so the first one's probably the easiest. You got your second dose of the vaccine the other day, and everything I had read is that the second dose usually elicited more side effects. Do you have any?
I did not have any. With my first dose, the next day I woke up and had a little bit of arm soreness. When I got this shot on Wednesday, by the time I went to bed, my arm was sore at the injection site, and I thought, oh no, I'm in for it. I'm gonna have a dead arm tomorrow. But when I woke up, I had absolutely no pain. I've had no other side effects, so I've been lucky. So that's been great.
And the reason I asked that is because I think a big part of vaccine hesitancy is people are afraid of side effects. So I just wanted to get that out
Thank
there.
you.
So I want to go back to those other sites you mentioned. Yesterday, the governor had tweeted out a Zoom call that he had with everybody. And I had noticed that not only was Michael Bidwell on there, but also Robert Sarver and Mr. Hall from the D-backs. So I know today we have State Farm Stadium. Are those other sports facilities, because of whether how big they are they being considered also for some sort of not some sort of, but when we get to the point where anybody who wants it can get it, are those the types of sites that you guys are considering for getting as many people vaccinated as possible? Or are you still banking on places like CVS and Walgreens to facilitate most of that?
So as we're working right now, we are looking for larger venues as we look to increase those mass vaccination sites. The pharmacies and our doctor's offices, once it becomes available, have a lot of power to push out vaccines pretty quickly because you're just multiplying the number of providers significantly. But I know that some of the partners have offered up some of those sites. We're really looking to make sure that we're geographically distributing them. And everyone has been very gracious with that, but those would be the kind of sites that we would be looking at as we expand mass vaccination sites.
And does that also mean that State Farm will no longer be a testing site?
No, so they are going to operate both the testing site. Actually, that's one of the unique partnerships that we have with ASU. Given their experience running kind of the testing site, they're doing some of the logistics for us there. And they will still be offering testing during the times that they offer it at State Farm as well.
And finally, while we were on this call, and maybe you knew about this before we got on this call, but the AIA voted to cancel winter sports for schools. The governor's administration and you have made it clear that, you know, kids need to be in school and learning, and there's a lot of positives to that. But now you have a lot of students who are going to miss out on sports because, I mean, let's face it, of the numbers in Arizona, of how out of control this is, does the state at least bear some of that responsibility for getting to this point where now we have a lot of kids who will not be able to play sports, including seniors who were probably hoping to go on to college, even if it wasn't Division I, probably hoping to go on to college and get some sort of scholarship at this point. Does the state bear some of this responsibility?
So we have been working very closely with the Department of Education and the AIA over the last couple of months to make recommendations. What we were seeing was that spread wasn't occurring in classroom. It was after school activities, including some of those sports. And so we know that they had taken a pause at the end of winter, or I'm sorry, the end of December, I guess that's not the end of winter, in order to kind of break some of that up, and they were going to reconvene to talk about what to do with the upcoming semester. We did talk to them about the possibility with Christmas having the rates so high. You know, and as I look at it as a parent and kind of as a public health professional, you know, a school and being in the classroom is probably the most important to have those eyes laid on. And then it would probably be those sports. I want children to get physical activity as well, but we also want to make sure that we're not increasing the spread and that we're keeping them and their families safe. Ultimately, the last thing that should close down are our schools. Like, they provide so many supports and education and a safe place for our children that should be the last thing out of all of those activities that would close.
I guess what I'm saying, though, sorry, is just, did it have to get to this point? I mean, it seems, I know a lot of other people talked about mitigation and this and that, but it does seem like at some point it got to the point where it was out of control, whether that be because Thanksgiving, December, Christmas, people gathering. But looking back, did it have to get to this point, or could we have changed it? Did we have to get to this point?
I don't know, when we look at what's going on around the country and around the world, I don't know that anything would have changed it. I think we're seeing a lot of spread in these small gatherings where there's not a great mechanism of enforcement, or even some of those, you know, even the ability to get in and encourage people not to do that. People are great when they're going out in public and picking up the takeout, but then when they get into a home with their loved ones, if they don't live with them, the masks are still coming off. And unfortunately, that's been fueling a lot of the spread. I just think it's been a long year, and there's a lot of fatigue around the pandemic.
Thank you.
Thanks.
Bud Foster in Tucson.
Hi, Bud.
Well, hello there, Dr. Christ. How are you?
I'm good. How are you today?
I'm doing very well. You've been talking a lot. The president-elect came out, his staff came out today and said that they're going to dump all of the doses out there rather than holding half of them back for the second dose. How does that affect the strategy in Arizona? Does it affect the strategy in Arizona, the fact that we might have twice as many potential doses out there as we have now?
I think that would, if we got access to a large number of doses, I think that would allow us to expand our distribution greatly and to utilize some of those places where people normally go to get vaccinated, like where you go to get your flu. So your doctor's office, your pharmacy, community health centers, we would be able to get that out a lot more widely so that Arizonans who want to get vaccinated could get vaccinated a lot quicker.
Do you think that will collapse the amount of time that it's taking now to get everyone vaccinated?
Yes, I think that would collapse the time. I think it would speed up the rate of distribution and vaccination if we could get it out to more places where more people have access. As we have to prioritize, and we're getting a certain number of doses each week, and we have to pull certain numbers off for the CDC plan or partnership so that those long-term care providers can have enough for the next few weeks. that dwindles down the supply that's available to go to some of those other large vaccinating sites and to other providers. And so if we got large doses, we'd be able to get it out a lot farther.
And something else I wanted to ask, kind of follow up on what Howie was asking you. 45% of the people in phase 1A have been vaccinated now after 3 weeks. How do you feel about that? Is that an adequate number? Is that not an adequate number? And these people are on the front line, so these people really need this and require this. What's this say about when the general public gets an opportunity to go out there and start getting their vaccinations? How do you feel about that 45%?
Well, with vaccinations, I always wish that we were at 100%. I think the 45% right now, you know, when we did some of those surveys, we knew that 55% of the people, even before the data, in our healthcare worker population were willing to accept the vaccination. I know I've heard from some of our partner vaccination sites that they still have healthcare workers scheduled out to like the third week in January, so people will still be continuing to get it. So I think that it's promising that we've had that much of that specific population vaccinated. The other thing that will increase that as well is, you know, we've hit 80 out of those 2,000 assisted living facilities, and a lot of those are all phase 1A population as well. So that will continue to increase as CDC is able, or as the pharmacies are able to get in and schedule and vaccinate those individuals as well.
And then just one quick follow-up here is going back to the fact that more doses are going to be released and going to be out there in the next few weeks. Have you guys started planning for that yet, or is that something that's just kind of out there and you're not really thinking about it at this point?
So the fact that the incoming administration wants to do that is relatively new news, but we will plan and adapt for that moving forward. Having the doses, we've been planning on getting, at least for the next couple of weeks, the same amount of doses that we've been receiving over the last couple of weeks. So we are anticipating that as we move through, we've got priorities where we want the vaccination to go, and we'll just assess at how much we can move through those priorities as we get more doses coming through.
All right, thank you very much. I really appreciate it. You have to be very happy there are no more big holidays where families get together, at least not in the coming next few months. Thank you very much.
Thank you.
Next is Isaac Stanley Becker, sorry.
Hi, Dr. Christ. Thank you for doing the call. I have two really quick questions. The first is following up on this issue of the second dose.
Okay.
And does the release of all of it at the same time not complicate your efforts at all if you're going to have to potentially, do you think you will have to then hold some in reserve to ensure that there's enough for that booster shot? And if not, are you not worried about supply issues and potentially not having that booster shot for someone who came in for the first shot?
We'd have to take a look. I'd have to take a look and see what the numbers look like and how much of that's been held back. The reason that they were holding it back is because, you know, they were at the very initial stages of the manufacturing, and so they wanted to make sure that they were able, in case anything happened with the manufacturing, or that they had those second doses. As they continue to manufacture more and more vaccine, having that reserve for the second dose becomes less of an issue. Although we would take a look to make sure that we would be able to have the forward look to make sure that people had that second dose. But I don't know that we would hold it back. Just given that if people want that first dose, we still know that that provides some level of protection. It's not the 95%, but we would continue to communicate with the federal government on that.
Got it. And then have you had a chance to speak with any members of the President-elect's transition team working on COVID? And sort of similarly, when's the last time you've spoken either personally or in a group setting with General Perna or the other leaders of Operation Warp Speed?
So I have not had the opportunity to meet with anybody from the President-elect's transition team. We did answer some questions that they had sent to us, just asking us, you know, like what were some of the concerns in that. We do talk with CDC and General Perna on a regular basis. I would say it was a couple weeks ago that I was on a call with General Perna, and there's one scheduled coming up.
In that questionnaire, was the issue of the second dose one of the questions the transition put to you, do you recall?
I don't recall that one being. It was more about like, you know, do you have funding constraints? How are you, you know, working on these priority populations? How are you ensuring that you're getting to very specific populations? So it was things like that.
Got it. Thank you so much. This is a marathon briefing for you. I really appreciate it. Not all health directors do this. It's really much appreciated.
Oh, well, thank you.
Terry Tang.
Hi, Dr. Chris, can you hear me?
Yes, I can.
Okay, hi, thanks for doing this briefing. I just have a couple questions related to vaccination in our prison and county jail system. I know 1B includes corrections employees, but can you just specifically lay out as much as you can the timeline for vaccinating state prison employees and when state prison inmates would be vaccinated, as well as county jail employees and county jail inmates? And then just lastly, within the state inmate and jail inmate populations, will there be consideration for prioritizing inmates with high-risk conditions before inmates in the general population?
Yeah, I'd be happy to talk. So we are treating our jail and prison populations just like we're treating the general population. So our healthcare workers in our jails and prisons are eligible to get vaccinated with the 1A phase. Some of them were able to just go into some of the vaccination pods. We are working with ADOA to see if we can get vaccine to some of those more rural areas to get the healthcare workers vaccinated at the prisons. Our correctional officers and our jail officers would be in the 1B prioritized phase. So they would be part of that protective services occupation. So they are coming up in most counties starting next week to get vaccinated. They'll be eligible for vaccination. In addition, in the phase 1B group, we have people who live at congregate settings that have high-risk medical conditions that put them at higher risk. So in the prioritized phase 1B, any prisoners or inmates that are over 75 will be included in that group. Anybody that has a health condition or some type of condition that puts them at higher risk will be in the 1B phase population. So a little bit later than this prioritized 1B, but in the 1B group. As we move into those healthy inmates that are just part of the general population within the prisons or the jails, they will actually be in the 1C group, because we do know that people who live in congregate settings are at higher risk for transmission of COVID-19. So they will be prioritized in the phase 1C, along with our 65-year-olds and other Arizonans that have high-risk medical conditions. And those congregate settings not only include jails and prisons, but shelters and other congregate settings like group homes and things that may not involve the high-risk individuals.
Thank you.
You're welcome.
Next is Stephanie Innes.
Hi, Stephanie.
Hi, Dr. Christ, you can hear me?
Yes, I can.
Thanks for holding this briefing. I just have two quick questions. So I'm about to post this story talking about the State Farm event, and I know that our readers, not all of them have access to computers. You mentioned 211, and there won't be like this call center number posted until Monday, is that right?
Right, but 211, so you could call 211, and if a county's already in a 1B, they will help walk through. They'll get you to an individual that can help schedule that appointment if you can't do it online or don't have the technology. If you're in Maricopa County trying to schedule the State Farm stadium, they will tell you to call back on Monday. That's when the registration will open up. But you definitely can do that through 211, and that will be on our website over the weekend.
And you'll post that phone number over the weekend too, or on Monday, that people can call? Is there a separate phone number?
So it will be through 211 or poison control.
Okay.
Yeah,
Okay.
so you can call 211 or you can call our COVID hotline number, which is on our website, and both,
Great. Okay.
they will both route you to the people that can schedule the appointment for you.
And people should not be driving over to State Farm on Monday afternoon, right? This
No.
is appointment only?
Yes, so we are launching it as appointment only, so please do not drive over. But we will open those appointments. We're doing a soft launch on Monday with appointments opening to the Phase 1B prioritized group on Tuesday.
Okay, and then the last thing is, when do you anticipate starting 1C? And then what about the general population, like people who don't fall into any of the prioritized groups?
So right now, if I had to anticipate, I would say probably end of February, beginning of March for moving into 1C, and it's probably the spring before we'll be moving into the general population later spring.
Okay, thank you very much.
You're welcome.
And our last question is from Amanda Morris. I'll unmute.
Hi, Amanda.
Hi, I actually just wanted to ask, it's not related to vaccine, so I apologize if you're not able to answer this right now, we can go separate. I haven't been able to get through regular media contact lines. I wanted to ask about the variants of the virus and about the efforts that the state is making to do sequencing of the virus, and whether we're ramping up funding for sequencing efforts or ramping up more real-time sequencing of viruses.
Yeah, absolutely. That's a great question. And it's actually something that we've been doing for many, many months now. The state has a partnership with TGen and our universities. And so what we do is we send a random sample of those samples. So like Sonora Quest and them are sending random samples to be sequenced on a regular basis so that we can identify if we've got any variants of coronavirus. And then the state lab will also do that. There are certain specific characteristics that the CDC has asked us to either sequence or to send to them for sequencing, but that is something that we have been regularly doing in a partnership with TGen. We are anticipating getting additional funding that will allow us to ramp up some of those activities with TGen and our university partners so that we can do even more sequencing.
Thank you.
You're welcome.
Okay, with that, thank you, Dr. Christ, and thank you for everybody for participating. Have a great